عقدة من لساني يفقهوا قولي اللهم إني أسألك علما وافيا رزقا طيبا عملا متقبلا شفاء من كل داء. This is Dr. Zunaira Faiz. Today the topic of discussion is the Polycystic Ovarian Syndrome, current concept and management. What is PCOS, Polycystic Ovarian Syndrome? It is a problem in which women's hormones they are out of balance. She develops multiple cysts in ovaries, can cause problem with periods and make it difficult to get pregnant. Weight gain, excessive hair growth and acne. Early diagnosis and treatment can help control these symptoms and prevent long-term problems. If it is not treated over time, it can lead to serious health problems such as diabetes and heart disease. Hormones in the Pcos, that is Polycystic Ovarian Syndrome, for reasons that are not well understood. Because the hormones get out of balance. The sex hormones get out of balance. Normally, the ovaries make a tiny amount of male sex hormones, androgens. In Pcos, they start making more androgens, resulting in anovulation, acne, and hirsutism. The body may have problem using insulin called insulin resistance. Blood sugar level go up. Over time, this increases the chance of getting diabetes. What causes Pcos? The cause of Pcos is not fully understood, but genetics may be a factor. Pcos seems to run in family, so chance of having it is higher if other women in family have it or have irregular periods or diabetes. Pcos can be passed down from either mother's or father's side. I believe this genetic predisposition is unmasked by weight gain, changes associated with puberty or stress. It is a disease with the spectrum of clinical presentations which include PCO, ovulatory, no hirsutism, no dermatological problem, and menstrual irregularities, infertility, obesity, hirsutism, acne, insulin resistance, atherosclerosis, and genetic BMI. BMI, that is the basal metabolic body mass index, BMI, lifestyle. Genetics, BMI, and lifestyles, that is the also concluded. What are the symptoms? The most common symptoms, they are acne, weight gain, and problems and trouble losing weight gain and trouble losing the weight. Extra hair on face and body. Often women get thicker and darker facial hair and more hair on chest, belly, and back. Thinning hair on scalp. Irregular periods. Often women with Pcos have fewer than 9 periods a year. Some women have no periods. Others have very heavy bleeding. Fertility problems. Many women who have Pcos, they have trouble getting pregnant, that is infertility, and of course leading to depression. Here is Miss Polypcos. Concerns are menstrual irregularities, obesity, and hirsutism and acne. So the woman, that is she, will have the menstrual irregularities and weight gain, hair facial growth, and acne. Spectrum of clinical conditions associated with Pcos. Pcos, that is anovulation, diabetes, insulin resistance, atherosclerosis, hirsutism, hypertension, and endometrial carcinoma. How is Pcos diagnosed? No single test can be used for diagnosis. At least 2 out of the 3 diagnostic criteria should be present. Infrequent and irregular periods, evidence of hyperandrogenism, polycystic appearance of ovaries on ultrasound, more than 12 cysts. The pattern is like that in the periphery of the ovary, the small tiny follicles, they are arranged. The size of each range from 2 to 9 millimeter, and the number of follicles, they are usually 8 to 12 like that. They are arranged in the form of necklace, beaded necklace in the periphery of the ovary, and central is stroma is thick. So this is the typical picture which we will see in ultrasound. Detailed medical history, physical examination, that is body mass index, and blood pressure, thyroid, breast, and hair distribution. Diagnostic criteria, that is the Amsterdam ASHRAE ASRM, that is the criteria defined Pcos as the presence of 2 out of following 3 criteria: oligo or anovulation, hyperandrogenism, polycystic ovaries on ultrasound with the exclusion of other etiologies of hyperandrogenism. So you can see here ultrasound appearance of the ovaries, then clinical pictures of it. We see that acne, hirsutism, weight gain, etc. Then biochemical parameters, they are also included. How is Pcos diagnosed? Again, you can see the cyst in this picture. These are small cysts in the ovary visible on both sides. How is Pcos diagnosed? By blood test, FSH ratio, FSH-LH ratio, prolactin level, screen for latent hyperprolactinemia, thyroid stimulating hormone, adrenal hormones such as testosterone, dihydroepiandrosterone sulfate, or 17-hydroxyprogesterone, glucose levels, and fasting insulin. How to manage? 2 aspects: relieve symptoms and modify disease process. Protocol of management in adolescence: counseling for weight reduction and lifestyle modification. Carbohydrate and fat restricted diet is very important. Diet restriction and exercise is the sheet anchor of treatment for the weight gain. Low glycemic index diet up to 85% will improve menstrual cycle regularity and ovulation in about 6 months. Even 7% weight reduction may lead to the spontaneous resumption of menses. Moderate physical activity, that is 30 to 60 minutes per day, should be goal of all the patients with adolescent Pcos. Now, if lowers circulating free androgens and insulin levels and moderate activity, increases these serum high, this is binding globulins, therefore decreases the levels of free testosterone. Hormone binding globulin, they are very important, and if they are increased, there is a decrease in the free testosterone level, which is already increased in the patient of the Pcos. So serum hormone binding globulins are very important. Menstrual irregularities, mostly managed by oral contraceptive pills and medroxyprogesterone acetate 10 mg per day, or micronized progesterone 300 mg at bedtime for 10 to 14 days, effective in the treatment of abnormal bleeding. If oligomenorrhea and amenorrhea does not respond to oral contraceptives and anti-androgens combinations, insulin sensitizing agents have to be added. A lean Pcos may also have insulin resistance, and therefore if they do not respond to oral contraceptive dose, insulin sensitizing drug has to be added. How to manage? Relieve symptoms. Irregular periods, we can manage it with the birth control pills and progesterone withdrawal. Associated prolactin, we can do associated prolactin dopaminergic agonist, excessive facial and body hair by cosmetic measures, spironolactone, aldactone. How to manage? Again, infertility treatment, rule out male factor and tubal factor, weight loss, ovulation induction therapy, that is clomiphene citrate and letrozole, gonadotropins in some patients, and in vitro fertilization. Other drugs which can be used, that is rosiglitazone, pioglitazone, dihydroinositol, myoinositol, and acetylcysteines and micronutrients. Cosmetic treatment, anti-androgens used in Pcos will prevent further hair growth, but the hair which have already grown have to be treated by epilation, waxing, by electrolysis or laser treatments. Acne may require oral antibiotics like erythromycin and isotretinoin ointment. Acne also gets cleared in 6 to 9 months by use of oral contraceptive pills containing cyproterone acetate. Response to treatment is assessed by resumption of menstrual activity, the menstrual cycle, and reduction in the features of hyperandrogenicity, improvement of biochemical parameters like reduction of free testosterone and normalization of fasting glucose-insulin ratio. Pregnancy. Your doctor will want to watch you for the signs of miscarriage gestational diabetes, high blood pressure, and early labor and delivery. New research suggests that the diabetes drug metformin will help prevent pregnancy-related issues. Babies who are born to moms with Pcos may spend more time in intensive care. Related health risks: see doctor regularly for the checkups, and you are more likely to have trouble from high cholesterol, which may lead to heart disease, including the high blood pressure and heart attack, insulin resistance, metabolic syndrome, and type 2 diabetes, obesity, sleep apnea, mood disorders like depression and bipolar disorder, endometrial cancer, especially when you are older. Conclusion: Pcos is enigmatic, still lesser understood. Diagnosis can be tricky. Management is age and need oriented. Lifestyle modification is the crux. Fertility can be difficult. And prevention of long-term implication should be kept in mind. That is, prevent MS. Thank you. Jazakallah khair. Hope it will increase and freshen your knowledge about the polycystic ovarian syndrome.